Hi, good evening again. This is Dr. Machani, the host for We Talk Facts. And today I have a very interesting guest, a very well-known guest. Her name is Dr. Padmini Murthy, MD, MPH, MS, FAMWA, FRS, PH. Let me introduce Dr. Padmini to all of you, and then we can go to Q&A and know her knowledge about public health. Today, the topic is public health. Why does it matter? So, Dr. Padmini Murthy is a globally recognized health professional in her roles as a physician and public health expert. Her research interests focus on women's health, human rights, and global health diplomacy, and AI in femtech. She is currently professor and global health director at New York Medical College School and NYMC School of Health Sciences and Practice, USA. Dr. Murthy also serves as advisor to two startup companies focusing on AI and healthcare. She is immediate past chair of Intersectional Council of APHA and past chair of the International Health Section of American Public Health Association and is the global health lead for the American Medical Women's Association and NGO rep to United Nations. She has worked as consultant with the United Nations Population Fund. She has been appointed as co-focal point for United Nations SDG Hub at NYMC SHSP. She has been working with UN ambassadors, first ladies, and UN missions to promote women's health globally with local efforts in Bahamas, Grenada, India, Liberia, Malawi, Nepal, and Republic of Suriname. During the COVID crisis from 2020 to 2022, Dr. Murthy has spearheaded efforts working with other NGOs to provide relief to India, Italy, Navajo Nation. She has been interviewed by Yahoo, CNN, Sky News, and other media channels. Dr. Murthy has made over 300 presentations nationally and internationally. She has been asked to speak at various high-level events at various international venues such as the United Nations, World Health Organization, and at the COP28 at Dubai, where she organized a panel with two first ladies on gender and health. She is widely published and is the author and editor of Women's Global Health and Human Rights, Technology and Global Public Health. Her other books include Minnie's Musings and Glorious Global Ganesh. She is currently working on her fifth book on women achievers. Dr. Murthy has been the recipient of numerous national and international awards. Some of them include the following. First Indian-born American in over 77 years to receive the Elizabeth Blackwell for her work in promoting women's health globally. Recipient of, I don't know if I'm saying this right, Sonar Truth Pin given to these women who excel in community service. Recipient of Jerusha Girard Oration recognizing her work to promote women's health. Recipient of citation from New York State Assembly women Jennifer Rajkumar for her contributions as an outstanding leader in medicine. In December 2021, Dr. Murthy has been the recipient of President of the United States Lifetime Achievement Award for Volunteer Service. In March 2022, she was named non-government advisor of the official United States delegation to the 66th United Nations Commission on the Status of Women. In June 2022, she was invited civilian health expert to the National Security Seminar at Army War College, PA. In June 2022, she received the inaugural award as an outstanding physician leader for work from Chung Gung Foundation, Taiwan. So there are several other global awards she has received, and I want her to come up and say a few words about herself. Dr. Murthy, go ahead.
Thank you so much, Dr. Machani. Thank you for having me on your show. And oh my God, thank you for your introduction. I wish it was briefer. But hi, everyone. I'm originally from India. I'm Indian American. I live in New York. And since my college days and also in medical school and training and post-medical school, post-training, I have been passionate about health for all and, both locally and globally. And I think as a clinician, once I went into public health, it gave me kind of a broader perspective of looking at health because it's a three-dimensional puzzle and we just can't look at one facet. And I see that when I talk to my students or other students. I'm invited to talk to them and I tell them, when I studied medicine, almost 30 years ago, it was different. We had a different output. And now we have it like, it's totally different. We look at it more community-based because of so many factors. And also, I think podcasts like these and other meetings we attend, they just help us grow, build our knowledge to see how can we work together? How do we individually also make a difference? Without, that's it to sum it up about what I want to say. Yes. So the last thing I want to say is, I'm a mom. I am very passionate about health for all, especially maternal health and promoting, the practice of public health, intertwining it with clinical medicine. And I like writing, and I'm also a yoga practitioner. So over to you, Dr. Machani. Thank you.
Thank you, Dr. Murthy. It's actually a great honor for me to have you on my podcast. And okay, let's start now about public health, why it matters. So the first thing probably our audience wants to know is, what inspired or drew you to work in public health? And how has it shaped your perspective as a healthcare professional?
Thank you so much, Dr. Machani. First of all, I would just like to say this definition of public health by Dr. Winslow, who is a hero to so many of us. He defined public health as the science and art of preventing disease, prolonging life, and promoting health through organized efforts and informed choices of society organizations, public and private communities and individuals. So that being said, when I was a young girl growing up with my sister in India, this is something I would like to share. My mom, who was a retired French professor, my late mom, and she always used to tell us about health and make us aware of these differences people have. So we used to have, in those days, a lot of domestic stuff. And every time I used to wonder, why do all these young girls come and knock at our door and say that, oh, we want to join. We want to be, work. And one day I said, like, my mom has so many people working for that. Why do you come here? And then I realized one of the girls said, because we all know your mother buys sanitary supplies for us when she buys it for you. And then it struck me, it's like, oh, so everybody is not as fortunate as I am. So I became aware of these differences, like where one stays and one lives and the access to basic supplies and also the awareness. And I guess when I was in medical school, I had a great biochemistry professor, Dr. Vasudev Rao, who unfortunately passed away 2 years ago. And he always used to tell us, some of us, like, think outside the bun, And then I started wondering, like, when we were studying biochemistry, he would also say that, why does this make a difference? How can you take it over to a broader community? And how do you practice what you learn to not just benefit one person, but a group of people, wherever you are? So I think all these, especially these two people, like my late mother and my late professor, they started getting me thinking. And then when I started my clinical rotations, in India, we used to call it social and preventive medicine in those days.
True.
So when we used to go for all these camps, I would start seeing one of the things which I really realized, Dr. Machani, which I even now after 30 years put that into whatever I do, is communication. To keep it simple and not use this complicated jargon. Nowadays, we talk about medical literacy, but I also think there is public health literacy because people need to be aware what are you trying to tell them without making them feel inferior or making them threatened. So I think communication, bringing it down to the level of the people you talk, anybody, any communication is important, any community. So I think, but to sum it up very briefly, this always was like, for me, an eye-opener. And I should say I'm very fortunate to have had parents who encouraged me to do, stuff because I would always be doing camps, Like I'm a Rotarian, but I've been a lifelong Rotarian. I was an interactor. My parents were big Rotarians. So I think all this like really set the stage for me. And my passion for clinical medicine was equally fuel for my passion for public health. So I hope I've answered your question.
Excellent. Well, very well said. So the next thing we want to know is, how does public health impact our daily lives, even if we don't notice it?
Thank you. That's a very good question. So how does it, for example, the water you drink? So I'm just holding up my bottle. So I know this water is safe. I'm able to drink it. But not everybody has the luxury of drinking clean water. So one of the things we know, the quality of water, the air we breathe. So that's all the result of public health initiatives. In so many parts of the world, still people don't have the luxury of drinking water. And when I travel pretty extensively. When I go somewhere, I don't even I always tell my students to, or I tell my daughter or anybody who cares to listen, that when you brush your teeth, make sure you use even the bottled water to brush your teeth, because you don't know what the water in the faucet is when you're traveling. And then even when we have food safety everywhere, all this is public health. And, wearing seatbelts. Why do we have seatbelts? Because it's a public health issue, because it is not only for an individual, but it's also for the public, that you need it for safety, for individual safety and for the safety of others. Because if there is a collision, you don't want to go out like, a missile going at that high velocity and hitting somebody else. So in everything we do, there is public health. We don't realize it because it's so seamlessly integrated into our daily life. So these are just a few examples, which I'm sure, your listeners can relate to anywhere.
Absolutely, ma'am. Absolutely. Now, how does public health intersect with clinical medicine, and why should clinicians care about it?
Okay, so that is, now I'm putting both my hats on, both the clinician and public health, because as I mentioned, not to sound redundant, we look at a whole community. We look at social determinants. I alluded to it briefly when I talked about how I became aware of what factors are. So it depends on where you live. So when we talk about a patient, we also need to have an understanding about the family. And where do they live? Have they migrated from somewhere? What are they doing? So all these are so important. So for example, the first line often is supposed to be your primary healthcare provider. But for so many people who lack access, it is the emergency room. So
Absolutely.
what is important in clinical practice is public health is you understand where they are, where they're coming from. So that really helps you, because these are the clues which we get. And that's why we need to play Sherlock Holmes and Dr. Watson here, because these are the clues, especially where they live. What are their eating habits? What is the family? So you're looking at it at this perspective gives us a better view and better training as clinicians. And I am, happy to say that I think the current generation of medical students, maybe for the past 10 years or 15 years, have a better grasp of it than we had when we were medical students, because we would look at it, okay, the patients come, what are the symptoms? Oh, these are the signs are elicited. This may be the differential diagnosis. But we never thought of, or let me rephrase that, we seldom thought of asking, where do you live? Where are you coming from? What is the water you're drinking? No, we just say, oh, this kid has worms. This kid has, maternal, had malnutrition starting from, the mother was pregnant. So and again, very briefly, we all care about children. The first 1,000 days are very important, right? From conception to when they are infants. So all this is public health, because why do we advise somebody to avoid certain things when a mother is pregnant, or take certain precautions when traveling? So all this is public health, including vaccines. So this is definitely public health.
Totally agree with you, ma'am. Totally agree with you. Now, can you share some historical examples where public health interventions made a major difference, or have significantly changed patient outcome?
Thank you. I think eradication of smallpox, and we need
Excellent.
to credit one of our, our American colleague for that. So this is like the amount of work which went into it, the amount of team work, and it was multi-sectoral. It was not only physicians, it was nurses, it was communication, it was people going on motorcycles to deliver vaccines. So that is one of the best examples of public health. And also polio. We
Right.
used to have the iron lungs. For example, if anybody comes to New York, they should go to, if they can, especially health, to the March of Dimes and see how the iron lungs were, which used to breathe for the people who were affected by polio. So unfortunately, that's how polio is eradicated, but polio and also guinea worm eradication, which
Yeah.
has been amazing. It's been amazing. The Carter Foundation has done an excellent job. So what I'm trying to say, and also again, historically, if we are talking about it, we all owe a gratitude debt, a big debt of gratitude to Edward Jenner. He was the
Uh-huh.
pioneer of vaccines, and also Jonas Salk, American. So these are all public health stories. I mean, I could go on and on. And the other thing I think is anesthesia. Modern
Uh-huh.
anesthesia is a major public health challenge. A major public health, what shall I say, a win for us, which overcame challenges, and also using antiseptics, hand
Uh-huh.
wash. So all this is really public health, which has stood the test of time and improved the lives of people. And also, the goals we have here when we look at the food we eat, the air we breathe. So definitely all these are public health wins, which have really contributed to improving the lives of so many of us here in the US and
Excellent.
right too.
Yep. Now, from a healthcare professional standpoint, what are the biggest challenges in public health, both locally and globally?
Well, I think some of the biggest challenges are lack of funding, lack of access, and lack of awareness. Like I was reading on LinkedIn today, there was a post that, do you know that oxygen, life-saving oxygen, is not available for so many people everywhere. So thinking about that is a challenge because we take it for granted. If somebody needs it, there's oxygen in the, in the ambulance, which comes to pick you up when you go to the hospital. But
Exactly.
if this oxygen is not there, what happens? So that's a challenge, is this lack of it and lack of access. And unfortunately, also the distance, sometimes people have to travel. It can be anywhere. It can be in the US, it can be outside, depending on geographically where you are. And then, like we've had fires in California, I'm in New York, and we've had ice. So the lack of accessibility. What do you do? How do you get there? And I think that the other biggest challenge, as I said, is people do not understand how they can improve their lives, because you can take the health in your own hands, because there's primary prevention, there's secondary prevention, there's tertiary prevention, but we can also fix something broken so that it doesn't break further. So when
That's right.
you about prevention, whether as a clinician or a public health person, you look at all this. And the other thing I would also say is that we need to have more teams, more interaction and sharing, because it's just not the healthcare providers, it's everybody, it's multidisciplinary. So I think that's how public health is, and it needs not to be like, you can't say clinical medicine is a mile away, public health is here. It needs to be a nice mesh of both. It's like really a three-dimensional puzzle. That's why you need both a bottom-up approach and a top-down approach.
Well said, ma'am. Now, when I have you, somebody such an expert in public health, I cannot not ask you about COVID-19 pandemic. So my next question is, how did the COVID-19 pandemic change or reshape the way we approach public health or the role of healthcare professionals in public health efforts?
Thank you. I think COVID has taught us many hard lessons, but it's also been a good educator. And one of the things I think is we realized the importance of sharing information and working together. The other thing we realized is that prevention and using some basic public health practices are helpful. For example, hand washing, right?
Mhm.
And then, I guess wearing a mask during the height of COVID and
Mhm.
making sure that we are responsible. And if anybody was sick, they did not go out. They did not talk to people. And I think even some of the, what shall I say, regulations which were there with regarding to testing before you boarded a flight, like 24 or 48 hours, you got your PCR, your rapid testing done, so that you could, board a flight. So I think it focused on that. But the most important thing, I think all of us healthcare professionals, we realized that we put ourselves first in taking care of the needs of the community we live in. So we put
That's true,
ourselves,
ma'am.
because we were the first line of defense. By your viewers may wonder, like, what is she talking about? We put ourselves first. I'm saying not in being selfish, but putting ourselves out there in the first line of defense. Because
That's true.
how many
That's true.
remember how many sleepless nights? And
Exactly.
also we started using technology because there were virtual visits to talk to your patients. So all this really came about during COVID. It reminded me of the Australian flying doctors,
Mhm.
and how they would, the radio used to be used to give information about something. People would contact each other through ham or the radio or something like that. So
Mhm.
now I think we used communication with the patients and also all the information. So I think it was a combination of everybody working together at all levels.
That's true. Yeah. Yeah. Now, how do healthcare policies shape public health and its impact on clinical decision making and outcomes?
That's again public health policies. They are, for example, if you're talking about quarantine, right? The international
Mhm.
health regulations, they definitely help clinicians give you some guidelines on what you report. We have that. What are a list of diseases you report to your local health department, right? So I think we know that because of these policies in place.
Mhm.
For example, if there's an infectious disease, you know that do you report this? Yes. And then so that it comes as a what is the point of distribution, or where did this whole thing start? You identify it. Where is a sentinel? So by having all these, and also, in all our healthcare facilities, we have these periodic inspections and we have guidelines which are given to us ever so often as how do you address these issues, because
Absolutely.
that's why we have policies which can be individual to the healthcare institution, statewide, national wide, and also in some instances globally. So I think these are so important, and that's why when they're communicated with us, for example, we abide with the rules locally, like what is in your healthcare, like what is in your state, and then what is in the country.
Absolutely, ma'am. Now, what are some of the exciting and promising innovations in public health that healthcare professionals should be aware of?
I think some of them is AI, you know,
I know
AI.
you're big on AI.
No, I think it's fascinating because I see that again, if it's used properly, how it's going to benefit others. Again, let me tell you, it's the clinicians, it's the public health people, or the policymakers who have the final say. But I think it's a very important tool. For example, I was talking to these people who started like looking at in my state in India of Telangana, which was formerly called Andhra Pradesh in Hyderabad. So they use this tracking device, use blockchain technology to track this gunny bags, food, which was going to the local Anganwadis. For,
Mm.
Anganwadi, for the sake of your listeners who are not be familiar, is a program which really helps to look at the needs of children, especially in the low socioeconomic group. And this is funded by the local governments. And also, they created this to track the gunny bags with the rice so that there was no issue and people were aware that it was there something which was spoiled, how long was it. So right from the start to where it was distributed, this was a pilot project which was rolled out. So I think this is really amazing. And I look forward to seeing how can public health, become more cost effective and reaching more people, in the US or anywhere else by using AI. Again, this is something important. I mean, AI is all there. Everybody is into AI. But I think the important thing, what I have found is how it is channeled. And we need to have some specific guidelines to how we would use. So you asked me about policy earlier on, Dr. Machani. I think we need to have some guidelines and policies for how we would deploy AI in public health.
Absolutely. Especially with science and AI nowadays.
Yeah, so that if I could just complete this, it benefits everybody, all the populations. That means leaving no one behind. When you look at the sustainable goals, development goals 2030 agenda, it's to leave no one behind. The no one includes everybody. Men, women, children, people with special needs, everybody. So I think AI can be used, can be harnessed. And if we have this conversation in a year later, we would be having so much more to talk, or you talk to any of your guests about AI.
That's true.
Issues we have addressed,
Yeah. So what I hear from you when it comes to AI, which I call augmented intelligence, is the big data technology. It can definitely improve public health, especially in disease surveillance and prevention efforts.
Yes. And also I would add to the surveillance, also it could help us to see which is strategies is more effective, like when we're talking about prevention, and it can be cost effective because you are not redoing something which didn't produce results, right? Mm-hmm. It's like you already have something which does give you enough information to say that if this is done this way, the outcome is better. So I think even not only is it going to improve the health and well-being, but also it's going to be pretty cost effective. See, that's how I look at it.
Now, this next question is very dear to me when it comes to public health, which is, how can we encourage more people to pursue careers in public health and engage in public health leadership without leaving clinical practice?
Well, I think by making them understand that public health is so intertwined with clinical medicine. It's not a separate entity. It can be merged beautifully, like I'm locking my fingers together. And also, I would suggest that it's not a competition for clinical medicine. Okay. It is a part, an integral part. Because basically, clinical medicine, yes, you're treating a patient, but when you treat somebody else, it becomes a group, it can be public health. But also, not only are you treating them, but you're also giving them information so that this does not happen. I'll give you just coming back to AI again. People are developing all these the apps and these different algorithms which help to detect a patient before from falling, especially older and hospitalized. So what is that? The predictability is pretty accurate. It's still in, trials in some of the places I'm aware of. But what does it tell you? It tells the clinician that this is an issue which they are aware of. So it's like kind of preempting. You know that this patient may suffer by falling from the hospital bed, right? After surgery. But then what are the precautions you take before? So that information when preventing is public health. But when it's rolled out, it's a part of clinical medicine. You see what I'm saying?
Excellent.
It's
fantastic integration.
So thin, so it can be beautifully, it fits well together, just like my fingers are, fitting into each other. So I
Yeah.
think that's why you don't have to give up your clinical practice,
Mhm.
but you just have your red flag up. So when you give your instructions to your nurses or your residents or medical students during rounds when going around, say that, okay, this patient, maybe this is what can happen. So this is what we do. Like we're so particular about the drug interactions, Dr. Machani.
Yep.
When you're prescribing drugs, the same thing.
Okay. All right. So I know people talk about myths about public health. Are there some, or is there a myth about public health that you would like to debunk? And how can clinicians be made aware of underutilized resources?
Okay. So debunk, as I just said, it's not in competition. It's
Mhm.
working together. And also, I think under resources, reach out to the people in the community. It's just
Mhm.
not the clinicians. Reach out to the social workers, reach out to the nurses, nurse practitioners, and maybe during and even the social workers, because I think they're all an integral part of keeping all of us healthy. So when we have grand rounds or journal club discussions, it would be good to have this, like what are the resources available in the community which can
Mhm.
be used in the community? Because nobody else knows that better than the people working in the community. So again, I would like to finish answering this question by saying communication, clear communication matters, you know,
Excellent, ma'am.
and
Now,
inclusion, and including all the healthcare people,
that's
the
true.
team.
So if you could implement one public health initiative, which can be locally or globally, that would directly impact or benefit clinicians and patients, what would that be? With so much vast experience you have in this field.
I would say improving maternal health, because I'm not
Right.
saying it because I'm a mom. We are all here because of our mothers. And to me, and I would like to say this, like this is my quote, there is no cure for maternal mortality, but it is preventable. So I think as clinicians, as public health providers, as concerned human beings, we need to work together to address the horrible rates of maternal mortality everywhere. I mean, even now, if you see, there are like more than 250,000, 500,000, more than 250,000 women dying each year in childbirth. To me, that is terrible because you don't want somebody to die giving birth, giving life to somebody else. And this is preventable. It's not, it's not like I'm saying it is largely preventable. So I think we all have the power within ourselves to see how can we address this for women everywhere who have children.
That's true.
Because I think, nobody can replace a mother. And we are
Excellent,
all
ma'am.
here,
Well
we are
said.
having this conversation because of our moms. If our moms were not there, we wouldn't be here. I mean, we all owe everything, our lives to our mothers, right? So
That's
I think, to me, if you ask me, the most important thing is maternal health, maternal health, maternal health.
great. Now, I know this is a very touchy topic nowadays, especially since the COVID-19 in some countries. And this is one of the, I would say, biggest initiative, which is vaccination to prevent diseases. So what is the importance of vaccination programs in public health? And how can clinicians combat vaccine hesitancy effectively?
So, this is like you're opening the Pandora's box on the show. But I just want to say that vaccines have known to save lives. And again, there are side effects of vaccines too. So when we are talking to a group of patients or one patient or anybody, you need to, in full transparency, they need to be aware of the benefits and the side effects of vaccine. So, and again, the choice is left to the patient, right? The person, the individual. But you do say the benefits for certain diseases far outweigh the risks. So again, this has to be, as a clinician, like if you're prescribing a particular medication, you tell them that these are the side effects. Like if I'm prescribed a medication, I will read Okay, and I will look at it and say, okay, these may be the side effects. The same thing about vaccines. We need to tell them, and maybe, as I said, the clear communication coming down to the level of the individual or the individuals we are talking to, definitely, in my
That's the
opinion,
key thing.
would kind of help to reduce vaccine hesitancy. Again, the message should be you're not pressurizing them to take a vaccine, you're just giving them all the information there is.
Correct. Excellent. Now, where can our listeners learn more or get involved in public health initiatives? And what advice do you have for healthcare professionals looking to get more involved in public health efforts?
Hello?
Did you hear my question, ma'am?
No, the last part I didn't. Could you please repeat it?
Sorry, I'll repeat that. So, where can our listeners learn more or get involved in public health initiatives? And what advice do you have for healthcare professionals looking to get more involved in public health efforts?
Okay, so thank you for your question. I think is to see what's happening in the local community and also to get involved, with your churches, with your temple, with your synagogue, with the mosque, because a lot of public health work is done there too, like formal and informal. And I think, again, by communication, talking to people, for example, if there are floods or there was a fire in California, so you want to go volunteer or you want to do a mission, we can start even locally. First of all, it's important to have a needs assessment, like what is needed. You just can't go. I tell my students, you just can't go and say, oh, yeah, I'm coming from here. I'm just going to do something. You need to talk to the local person. You need to build partnerships the same way. Talk to the people in the community, like who's volunteering, what are they doing? And when we have all these community health fairs, which a lot of the health departments also organize with the faith-based organizations, I think this is a great segue to get involved. And for students, the
Thank you.
clubs we have on universities, they know what's going on. Like, I'll just share an example. Like, I told my
Sure.
students, give up their latte for a day, collect that money, and we use that to do something like, buy safe motherhood kits to people in need or to, provide menstrual equity. So it's just like, talking and getting together. And again, it takes a small band of dedicated people. So I
That's
think
true.
we all do what we do.
That's true. Dr. Murthy, this has been a great discussion about public health. With my little knowledge, what I had about public health, you have given me a lot of information about public health, even to our listeners. And it has been my pleasure and my honor to have you on my show, have a great discussion with you. And do you have any final points or take-home points to our audience?
First of all, thank you so much for having me. I enjoyed myself, and I hope what I said was made sense. I think the last point I would have is believe in yourself, that you can be the change you want to. That's all I would say.
Thank you, ma'am. Thank you.
Thank
Here
you
you go,
so
listeners. We have one of the best well-known persons and an experienced person in public health, women's health, who has achieved so much in her career, in her life. And she happens to be coming from my part of the world, southern part of India. And I'm proud to have her on my show. And I'm sure you all enjoyed the show. And keep listening. As we always say, we talk facts. Thank you. And until next
Thank
time.
you so much. Thank you so much. Have a good night. Bye, everybody. Thank you.